The global number of new infections and deaths due to COVID-19 has steadied since the end of August. For the past several months, the BA4 and BA5 Omicron subvariants have driven most new cases. But scientists say a number of worrisome new subtypes are also fueling the pandemic. In the U.S., but also other places, they include 3 types that together now account for around 1 in 7 newly reported cases there. In Europe, a lineage detected first in Asia has grown in prominence. In the UK, which has a top-notch surveillance system, experts are tracking the possible rise of still others. And Indian scientists and authorities across the globe are chasing data on a troublesome variant dubbed XBB. In Singapore, estimates show it could now be causing over half of all cases.
And as we come into the wintertime now, we are starting to see further increases in SARS-CoV-2 activity. And part of that is being driven, obviously, by these different Omicron variants.
And another infection is compounding concerns, the flu. Earlier in the pandemic, measures that slowed the spread of the coronavirus also helped people avoid getting infected with other pathogens, like those causing the flu.
Influenza, like SARS-CoV-2, is a respiratory infection. So the measures that were put in place to reduce COVID transmission also impacted influenza transmission. So when we reduced our mixing with other people, when we reduced our international travel, that also reduced the ability of influenza to spread.
But as the urgency of the pandemic subsides and measures relax, flu cases are also rising again. Both diseases pose a particular threats to groups like the elderly or people with underlying health conditions, and also to healthcare workers.
Although they may not be at elevated risk of severe disease, if they fall sick, then that also increases absenteeism from work, which has important implications then for the workforce and its ability to the healthcare system to operate. And of course, there's also potential risks that healthcare workers can infect their patients as well.
In an effort to head off the worrisome scenario of a twindemic during the upcoming winter, healthcare authorities from the World Health Organization and other institutions are now spreading a simple message. Timely vaccination against both diseases can save lives.